And welcome back. The Mom Jeans campaign looks at facial aging. A survey conducted by Galderma found that the selfie culture causes 90% of mothers and 88% of daughters feel there is more pressure to look younger longer. What can women learn about their own facial aging? Well, a good place to start is looking at their moms. Well, I want to welcome Dr. Tina West here with us today to kind of explain what is the Mom Jeans campaign.
Well, the Mom Jeans campaign, which is jeans, G-E-N-E-S, as opposed to the other type of jeans, is sponsored by Galderma, which is a company that dermatologists have worked with for years. And it encourages women to celebrate their mom, to upload a photo. You take an old photo of your mom that you recreate, and basically it's a photo of you as your mom, and kind of style yourself and your background similar to how your mom looked, and then you upload it onto momjeans.com. And it's kind of a shout out, a tribute to your mom. It's coming right along with Mother's Day. And then in addition, Galderma will donate, make a donation to the National Charity League, which actually supports women and empowers women leaders.
This sounds so interesting. I love this. So why is the conversation about genetics and facial aging, why is it so important these days?
Well, I mean, I think a lot of women, love and really look up to their moms over their lifetimes. Their moms, along with dads, of course, really act as role models throughout their lives. But women also start to notice changes that they're seeing in their moms. And that's
what we're looking here on our screen. There's got some pictures there.
Yeah, exactly.
Okay.
Women would like to know what they could potentially do to prevent or delay the kinds of changes they're seeing, like sagging skin and wrinkles and that type of thing.
That's what was my next question, is what can we learn from looking at our moms about our skin?
Yeah, you can really learn a lot about how your face is going to age by looking at your mom, because there's a really strong genetic component that determines how the face ages.
Is there any way to fight some of those things?
Absolutely, absolutely. That's the great news. One of the main reasons why we start to age or show those changes that we associate with aging is because we lose volume in our skin over time. So most people know that we lose collagen, but actually you're also losing bone, muscle, fat over time. So what happens is that you have a more youthful contour, and your cheeks are a little fuller when you're in your 20s, for example. And then as you age and you're losing volume, the skin, there's less volume to hold the skin up, so the skin starts to kind of fall down, and that's when you start to notice jowls, you start to notice wrinkles, downturning of the corners of the mouth, and that's what we're addressing when we talk about trying to prevent or delay these changes.
So what do we do when we start to notice these signs of aging?
Well, fortunately, we have some great products out there that can really help with that. In the past, even since I've been in practice, we used to have to remove fat and use that to restore volume. But that was a much bigger procedure, and now we have these amazing fillers that we could use that are natural, that are natural looking, that can be used gradually over time. So I know in my own practice I use a lot of products from that Galderma portfolio because my patients love the really natural results that they get.
Absolutely.
So for example, there's a product called Restylane Lift. That's one we use a lot. That is a natural sugar that's normally found in your skin, so there's really very little chance of having any type of reaction to it, virtually no chance. And we use that to replace volume loss, and it's the only filler actually approved by the FDA to lift the cheek and to smooth and soften the smile lines. When we start doing that earlier on, so one of the big trends, we like to call it prejuvenation, is that we're starting earlier. So when you first start to see the volume loss, you're starting to add volume back over time. So it's very gradual. You don't look like you've had anything done, which is what most people clearly are looking for and worried about.
Right, because we don't want to look weird. How do we avoid looking weird? We don't want that plastic look where we can't blink, or we look too much like a Barbie doll.
Well, avoiding that look is all about who is doing the injecting. Basically, a filler, giving someone a filler and a face is like giving you a palette and a canvas. So it really has to be an artistic approach. It has to be someone with a lot of experience. That's really the bottom line. I mean, you really have to know about the full facial contour and about balancing the face. A lot of people come to me with filler that has been done where it's not really balanced and it looks a little off, to rebalance it. So that's really an important concept. So not only these great fillers that we have from companies like Galderma, but also the way that they're being utilized.
Right. And how long does a filler last?
Well, fillers like Restylane Lift can last at least a year. What we've noted over time is that we see a cumulative effect over time, and that's really the most amazing part about it. So what we think is that it stimulates your own cells to actually produce more collagen. So that one is a natural sugar, but then we also have another type of filler called Sculptra, That is one that's different. It's a unique product that's used a little bit deeper in the skin, and it actually is injected as a liquid, and it actually forms a scaffold that your own body builds collagen on.
Okay.
So it's a little bit of a series of treatments, and it takes a little longer to see the results, but that lasts longer than 2 years.
Right, because you're rebuilding. I like
exactly.
that.
And the newest one, which is really exciting, is called Restylane Silk, and that's actually the same type of sugar, hyaluronic acid, normally found in your skin, but it's a different formulation. It's engineered a little differently, and it's specifically FDA approved for and specifically engineered for restoring aging lips. So a lot of women don't like how their lips are sort of sinking in. You know, you're losing collagen there too. So that shows as like a loss of the border and a loss of the distinctive.
And this rejuvenates.
Well, it's what we call reflation. So instead of augmentation, like younger women may want those really full lips, older women typically don't. They just want to reestablish their lips. So I call that reflation. And we're just putting back the lip as it was before, and it gives a very natural result. But you're not, you know, it puts back the border, it gets rid of some of the fine lines around the lip.
All right. Well, Dr. Tina,
great.
Thank you so much for joining us today. We're going to have more information right here on our screen on how you can get involved in the Mom Jeans campaign. Stay with us. We have more of Let's Talk Live coming up right after the break.